every contact with a patient, service user or the public must count as an opportunity to maintain and, where possible, improve mental and physical health and well-being.
Making every contact count is about using opportunities to help people improve their own health, sort of nudging them and guiding them. I see a lot of patients who have got problems which are caused by their lifestyle choices, or they are heading for a great deal of trouble because of their lifestyle choices. And part of what I should be doing as a doctor, I believe, is to help them achieve better health, often with quite straightforward interventions.
During your normal working day, you can use the contact you have with patients, service users and the public to give healthy lifestyle advice. Someone following all of these healthy lifestyle choices would live on average 14 years longer than a person who followed none, not smoking, eating a healthy diet, drinking alcohol within the recommended limits, doing the recommended amount of physical activity. That is why making every contact count should be important to everyone. Why make every contact count? Hear from those who provide lifestyle advice and make every contact count as part of their regular work.
We have patients who have really benefited from MEC advice. They've managed to lose weight, they become more physically active. We've increased referrals to our health promotion services and specialist support services, and it has had real benefits for individuals.
You engage with your patients. What I now say to them is, look, it is causing quite a few problems for your health, or is going to. If you go and see an expert who is trained in helping you give up smoking, you're very much more likely to do that. Are you happy for me to refer you to that organisation? And they almost always say yes.
We find that patients expect us to talk about it, and if we don't, they go away disappointed, and evidence shows that that is right, and we have examples of that within our organisation. Clients have actually said, I am so glad you have spoken to me about this, I have been so worried about it.
Sometimes there's a way of getting them to realise actually your health choices have actually led to very significant problems. There's something you can do to make a big difference to your risk for the future, and this is what I'd recommend. I've had so many grateful patients who've said, actually, you know, that really brought it home to me how important it was, and I'm really pleased you mentioned it.
The more that's done on prevention, the better it is in the long term, because we already know that we're going to get more and more people who get older, and if they're used to being active, they're less likely to have comorbidities and other problems in later life.
How MEC works at Birmingham Children's Hospital, we've got an overall lead for it, our health promotion champion. She works with nursing and other staff in the hospital to really spread the message, to make sure it's not just one person that's leading, it works right across the organisation. I think it's really important that staff within the hospital can see that the board are supporting what's happening with regards to making every contact count. We've also used our governors, being a foundation trust, and they've gone round the hospital and they've talked to staff and talked to families about the impact that they think it's made. And then it's also practical things, like we've changed from having biscuits and tea and coffee in our board meetings to having fruit and water on the table, so when we're having our public sessions people can see that we're absolutely committed to that overall improving health agenda as well. I think it's about ensuring that it's a key part of everybody's role. It's not a special thing that we do on the side, so it's incorporated into our core business. And they could have said, we're really busy, we're providing clinical care, we've not got time to do this, but people have found really practical ways to just add the questions, add the intervention on to what they're already doing on the wards and in departments.
Bizarrely, some doctors don't actually necessarily see it as part of their day-to-day responsibility. Once consultants realise it actually makes things quicker, and is more effective, they're quite keen to adopt it. Sometimes the problem is just time pressures. I mean, we are having to see an awful lot of patients, and people might not always see it as being an appropriate time to bring up things such as, you know, their smoking, or more frequently now really their obesity or their lack of exercise.
All staff are really important on delivering on the MEC agenda. The porter who has that conversation with the client, our reception staff, they are all as important as the professionals that we employ. And working as a team, they can then support each other to deliver on the MEC agenda.
I think the great thing about introducing MEC here for me is that I haven't had to go around and tell people why it's important. They've told me why it's important to them. I think it would be fantastic if we could make it a culture of the NHS going forwards, and that would be in every interaction, whether it's in hospital, whether it's in a community setting, whether it's in a GP practice. If we can help people to make small changes in their life, that could contribute to their overall health as well. So I think its potential's endless, and if we could roll it out across the whole country and join it together, then we really would start to see it being a real force for change.
You can make every contact count. Making every contact count can really improve a patient's experience and clinical outcomes. Patients expect to be asked about their lifestyles.